Good evening to all the followers. Good evening. You are live on the COVID Gambia platform. We're just about to start updating regarding the COVID situation in the Gambia and our general discussion that we've been doing these past weeks. We welcome you on the comment section as usual. So just feel free to post your comments or your questions, and as we're going, we will be trying to answer them as we go, okay? We'll just allow some more people to join the live before we start with the updating. We'll just allow more people to join before we start with the updates. Good evening, everyone. Thank you for joining. Thank you. Thank you. We'll just allow more people to join. 2-3 more seconds, and then we will start updating you with the information that we've been putting together. Thank you for joining. Thank you. Hello, Badara Saja. Thank you. Do not forget to post your comments or your questions in the column, in the comment column, and then we will be answering them as we go. Okay. Thank you. And then also invite your friends to join the COVID Gambia page for live updates and discussion regarding the COVID situation in the country. Thank you. So as usual, I'll just introduce this platform for the new followers. This is the COVID Gambia platform. It's a platform that has been created by concerned citizens, professionals in IT and communication. We've just decided to join together and see how to contribute in this fight against the COVID-19 in the Gambia. So as communication and IT professionals, we just set up this platform and other initiatives as well. So through this platform, we try to gather reliable, verified information and relay it to the public as we go. Whenever we come across any important information that we feel is necessary to just share with the public, we would be posting it on our page for people to be able to read it. And we will also come live every now and then when possible, organize a live session where we will be discussing with the public about whatever we have found out regarding this COVID-19 situation in the country. And we thank you so much. I see that we have our keen followers that are back on tonight again. Charles, thank you so much for being here again. We really appreciate having you on our platform during our live discussions. You're always there to support and to encourage, and that means a lot. Thank you so much, and thank you to all of you joining. Okay, so we will start with the figures of the day that we've received from the Health Ministry. Okay. It's important to note that the figures of the report, there was an error, and that we posted it on our page. There was an error on the report of the 23rd, and the Health Ministry has informed the public about that error and has kindly requested that people ignore that report and really rather focus on these latest figures that I am going to announce. The report that got released shows that there is 101 new cases in the country, and then 3 new deaths and 111 new recoveries from the 379 tests conducted. So on a number of 379 tests conducted on the population, there has been 101 that came out positive, 3 deaths have been registered, and 111 people have recovered that have been undergoing some treatment and have recovered. So the Gambia currently has 1,995 active cases, okay? it's, I mean, we can clearly see, I'm not going to analyze the figures. We'll try to do that during our next live. But all we can say is that currently the figures are showing that the virus is spreading at a rapid rate within the population, and that it is far from being under control. So there we need to mention more than ever the importance of respecting the preventive measures, which are to wear your mask whenever you are outside. Make sure to wear your mask and make sure to apply the right hygiene measures to your mask. Once you get back home, make sure to wash it and to not wear it again after wearing it the first day without washing it. Make sure to wash it properly, dry it, and then wear it again when you're going out, when it's reusable mask, of course. And then always make sure to apply social distancing wherever you are. Never get too close to people, because you never know. Some people are asymptomatic, meaning that they might have the coronavirus within them and then spreading it around without even knowing it. So seeing somebody healthy walking in the street does not mean that they do not carry the virus. So make sure to always respect the distance, a certain type of distance between you and the next person, because you never know who is a carrier. So those are some things that people constantly need to be doing going forward, because obviously people cannot remain sitting at home. People have to be going on and about their businesses during the hours that are allowed, where people are allowed to circulate. So during those hours, make sure that you always respect the measure, the preventive measure, the barrier measures, to make sure that you protect yourself and that you also protect others. And whenever you feel a certain type of symptoms that you do not understand, instead of rushing to the nearest health center, always try to self-isolate. Call the 1025 number, which is operational. You call the 1025 number and explain yourself, and then you will be guided through the process. Okay, so these are things that we will keep on repeating each and every time we come live, because it's important to repeat and repeat and repeat until people really get it and get familiar with some of these procedures, because this situation is, I would say, relatively new to everyone. So some of these things might not be automatic for everybody. So it's important to keep on repeating it. So for our followers, also make sure to always spread the words around your entourage, speak to your people about it, and always remind each other about the importance of preventive measures. It's quite important. Okay. So, Sehu Seydili, please could you consider speaking in local languages for the benefit of those who can understand English? Thank you, Sehu Seydili. If you are a follower of our page, you would notice that, or you will realize that we always start with English, and then as we go, whatever we say in English, we translate it into Mandinka or in Wolof. Obviously, I cannot be doing all the languages, but as I am going, you will notice that whichever information I'm sharing right now, I will be translating it in Mandinka or in Wolof, whereas possible. I usually do the lives with a co-host, but unfortunately, the co-host is not does not have the possibility to be here tonight for personal reasons. So I am forced to do it alone, and alone means that I will not be able to just juggle between the different languages as much as I would like to, but I will do my best. Always make sure to cater for the non-English speaker, obviously. Thank you for your comment. Anyhow, we would proceed regarding the Serekunda Hospital. As you can recall, sometime last week, there was an announcement about the Serekunda Hospital going to be turned into a COVID-19 treatment center. That information reached the public with lots of surprise. People were really surprised and very worried once that information came out, and the reason being that we all know the importance of the Serekunda Hospital within the Greater Banjul area. I would say you have people coming from all over the place to the Serekunda Hospital for different kind of treatment and different kind of pathologies or of symptoms. So that hospital being turned into a COVID-19 treatment center raised eyebrows and lots of question marks. Because we didn't have much details regarding that and what would happen with the other patients that needs to be catered for. So that was the major questions, that the major interrogation that people had. So it seems as if the CEO, Mr. Mane, the CEO of the Serekunda Hospital, came out explaining that this is something that has been announced, but it's not going to be feasible right now. Obviously, there are lots of processes to look at or to take care of before a hospital such as the Serekunda Hospital can be turned into a COVID-19 treatment center. And he mentioned the fact that there are lots of adjustments to do, and some of those adjustments are mainly that their staff are not trained. Their staff are clearly not trained to cater for COVID-19 patients. You also have issues regarding the movement of people within the hospital. That's also another issue. I mean, when you talk about a COVID-19 treatment center, it has to be a secured place where that is really reserved for health professionals and patients carrying the COVID coronavirus or the COVID-19 virus within them. But if you open the hospital for the public and for those people who are also carriers of the COVID-19 virus, it might really create some sort of serious concern and serious situation. So that being the case, I think that they have postponed or they are still working on some modalities before they can go ahead with that. It's not going to be easy, and it's not going to happen anytime soon. And you also have the issues of respiratory machines that are not available at the Serekunda Hospital. They do not have any respiratory machines or oxygen also. Oxygen supply is lacking. So clearly they are not equipped to cater for COVID-19 symptoms, COVID-19 patients, sorry. So it's clear that this is an announcement that has been made and that has been made to the public, but it's clear that the Serekunda Hospital is not equipped and prepared to really cater for COVID-19 symptoms. So this is something that is clearly not feasible at the moment. So the public should not panic and expect to not have the Serekunda Hospital as a hospital where they can head to. They can still go there and be treated and be attended to. And whenever a new development is going to happen in that sense, I'm sure that the announcement will be made, and we will also relay it on our page here for the public to know about it. And we move on. When it comes to the Red Cross, we've been following their activities. They've been very, very active on the ground, and even in terms of sharing information about their activities, what they're up to. I think that they're doing a really good job in informing the public about what they are up to and the type of operations they are conducting. And it's really helping us, some of us that are relaying the information, especially on this COVID Gambia platform. It's really helping us to have accurate and clear information to relay to the public. So we really appreciate the fact that the Red Cross is coming forward with lots of information, and we are very clear about what they are up to on the ground. So we know that they've been engaged in some fumigation activities. Lately, we've seen that they went to the airport, sorry. They went to the airport, the Banjul International Airport, and they fumigated the entire place, which was something, I think it was a first. And that has been conducted, that operation has been conducted in the airport, clearing, trying to spray the place and get rid of any trace of COVID-19 virus around that area. So that all that for the safety and security of people, travelers, or staff, or anybody getting close to the airport. So that's also a very important action. We've seen also that sometimes last week you had a team of Senegalese medical experts that came in the Gambia. The purpose of their trip was to enhance collaboration and share experience with the Gambian Health Ministry, health professionals, so they conducted visits in different places like MRC, like the Ndemban Clinic also, the Ndemban Treatment Center. They just that we're just showing on our screen. If you can just hold on for a second for the technical side to bring back those footages. So even the President Barrow, they held a meeting with the President Barrow and explained the reason. It was clearly a courtesy call that they paid to President Barrow, but other than that, they've been visiting like MRC, the laboratory in Kotu, which is the national laboratory, the sanatorium in Kotu. They visited also the Ndemban clinic that has recently been renovated. I mean, part of it has been renovated, but by TAF, as we've seen in the past. So all that has been conducted by this Senegalese team of experts, and I believe that there's been lots of technicalities that have been discussed with the health ministry also, and potential areas of collaboration probably, and they will take it forward, and we will see what will happen next. We're not really privy to know what is going to happen next, but we keep on following, and hopefully a collaboration between them two might lead to something that will benefit the Gambia, knowing that we are really struggling with be it contact tracing, be it testing in time, and so on and so forth. So there's lots of difficulties that we are facing in the Gambia here when it comes to this COVID-19 situation. It is true that Senegal themselves are dealing with their own situation, but as we know, they are better equipped than us, and they probably, as their country is bigger, they have more healthcare professionals there. So I'm sure that collaborating, being all part of the ECOWAS region is something that is recommended between different countries to share experience and knowledge. So I believe that it's in that regard that they came to the Gambia. We will move on to the question section to see what is being said around there. If you can bring up the questions on the screen, technical experts. What is COVID Gambia about, and what are you hoping to achieve? Everything is already reported via Ministry of Health. Mariama Sanyan, thank you so much for your question. What is COVID Gambia about? COVID Gambia, like I said, and like I keep on saying during every live at the beginning, we've started this platform at the beginning of the pandemic, which is since around March, I believe. We are a team of concerned Gambians. We are professionals in communication, in IT. So together as concerned Gambians, we just started brainstorming to see what we can possibly do to help during these difficult times, as this is a collective effort. It does not only require the government effort, it requires everybody's input. So what we decided to do during that time, since almost 6 months back now, is to join as a group of 4 people and see how we could possibly contribute. So what we decided to do clearly is to start this platform. As you can see, if you have time to go through history on the platform, you would see that it started around March, and then we've been relaying. We've been, first of all, establishing collaboration, meaningful collaboration with the Health Ministry, with the Red Cross, National Youth Council, you name it, okay? We've established meaningful collaboration, and the purpose is to be able to relay and verify reliable information. We are also in collaboration with some other authorities, like some other institutions, like health institution, internationally, to be able to bring in the Gambia all the verified and reliable information that can help during these trying times, okay? So what we also do is that we develop IT tools that can facilitate the work of the health professionals, okay? We develop IT tools that can facilitate communication between different platforms, between different actors during this crisis. So we are clearly here to contribute, Mariama. So it's true that everything is already reported via the Ministry of Health, but if you see that the Ministry of Health is also welcoming collaboration, it's because the Ministry of Health cannot do it all on their own. They need the contribution of citizens, they need the contribution of professionals to join in the fight against the COVID-19, and it's collectively that we will be able to achieve something. So this is the reason why we're taking our time. I mean, we're all very busy, we all have our jobs, and we all have our family lives, so it's very complicated for all of us, but we still feel that we need to come and do something. So clearly this is what we've been able to do. So far we've been trying to update the general public about all the information that we are gathering coming from different platforms, and then we relay it all on this COVID Gambia platform for people, to make life easy for people instead of going and looking for information everywhere. You know clearly that on COVID Gambia, you will find all the reliable, verified information, be it from the government or other institution or from other groups or organizations. Mariama, thank you. I hope you got your answer. Yes, and I hope that you will be following our page and that you will be recommending it to other people as well, okay? Yes, so let's move on now. Next on our page, I think we have yeah, we saw that in Basse, clearly there's been about 10 people who have been fined $5,000 for not respecting the curfew. So it's important to also relay what's happening in other regions. Gambia is not all about the combo, so we also need to talk about what's happening clearly in other regions. So we've seen that in Basse, you have those 10 people that have been fined $5,000 for not respecting the curfew, or failure to pay that amount will lead them to serve a term in jail. Okay, so I mean, as we always say, make sure to respect this curfew and this all the preventive measures and all the measures that have been announced by the government under the state of public emergency. It's really important. We do not want anyone to get in trouble. When they say wear a mask, it's important to respect that. You're not only doing it for the government. I mean, you're clearly not doing it for the government, you're doing it for yourself, to protect yourself first and foremost, and to protect others. So it's important for people to really adopt that behavior going forward, because this is going to be something that we will have to really seriously adopt and be with for some time. So wearing the mask is, I would say, the new norm for now, at least until we do not know clearly when, but for now, this is the new norm, and people have to adhere to that new norm and respect it. And there's a fine for people who are not wearing their mask in public, and there's a fine for for vehicle owners who are letting people on board their vehicles without a mask. So if you consider all that, then you will know that it's better to respect those that measure of wearing a mask, and also get knowledge about the reason why you should be wearing a mask. COVID-19 is real, is in the Gambia. People are being infected. You do not know clearly who has the virus or who does not. So it's very important for you to protect yourself and to also protect others in case you carry yourself the virus without even knowing it, in case you are asymptomatic. So this is the reason why we keep on reminding people about the importance of doing that. And also regarding the curfew, it's very important to also respect those hours. From 10 p.m. to 5 a.m., people do not have the right to be circulating around town. You should be indoors in your house, or at least indoors, and not be found in the streets. Failure to respect that measure, unfortunately, will lead you to trouble. So please get familiar with that until whenever that measure is going to be lifted. For now, the state of public emergency is on, and we need to respect the curfew hours, which are from 10 p.m. to 5 a.m. So people need to be constantly reminded about that to make sure that nobody gets in trouble. We've seen around that the KMC is also trying to enforce some measures, especially regarding social distancing in the markets. This is quite challenging, as we know. I mean, we've seen clearly how crowded the markets are. So having people to social distance in markets is a big challenge. But the KMC has been committed to enforce that solution, I want to put it that way, by trying to really get people to respect a certain limit between the vendors and the buyers. Okay, so meaning that anybody who is selling will have to be standing for a distance away from the people who are coming to buy. So there's something that's currently going on. If you go in the markets around the KMC area, you'll see clearly that the KMC is trying to really put in place those measures and facilitate and enforce them, I want to say, to make sure that people do not really get close to each other or do not actually touch each other. Okay, so this is something that's also, they've also put more hand washing stations across the market, meaning that when you're in the market and you're selling, you can clearly access some hand washing points easily and frequently wash your hands as it is recommended. Okay. We've seen that some funding has been secured regarding the renovation of the Ndemban clinic. There's an amount, quite a substantial amount that has been secured, and the renovation of the Ndemban clinic is going to be starting. The second phase of the renovation is going to start quite soon now that the funding has been secured, which is a very good news, in fact, because means that the Ndemban clinic is going to be one of the biggest COVID-19 treatment center in the Gambia going forward. So it's a very positive news to learn. And a press release from the government, we've seen that the 2021 tourist season will go on as normal starting from October. I mean, if anybody has questions in that regard, you're welcome to ask. But this is the press release that we've seen coming from the government. I don't know, people might have concern regarding the tourist season this year, starting from October, meaning that our country will be welcoming people, tourists. There are measures that have been announced already regarding the 72 hours COVID-19, less than 72 hours COVID-19 test prior to arrival in the Gambia. Anybody coming to the Gambia should have that test prior to entering the Gambia. There is the big question that the majority of people are asking is how can people come on vacation knowing that the 2 weeks mandatory quarantine is still on, which means that out of a 3 weeks holiday, people come and spend 2 weeks in quarantine, and 1 week, if found COVID-19 negative, are allowed to enter, allowed to be free in the country, and then spend only 1 week. I mean, it might be worthwhile to some people, but we're really skeptical about how this tourist season is going to happen, knowing that even in terms of cost, might be quite costly for somebody to leave Europe, buy their air ticket, and then have to cater for their own quarantine once they arrive in the Gambia, have to pay for their test prior to arrival, also have to pay for their COVID-19 test and get the results prior to arriving in the Gambia. So all those are factors that might prevent some people from coming to the Gambia on tourism. But then let's wait and see. The government has announced that the tourist season will be going on as normal starting from October. This is the news that we came across. Any other question in the column section? Mariama, yes, the Minister of Tourism has said Gambia will be opening from October onwards. Do you think this will happen, and is it safe to do so? I mean, this is clearly what I just explained. Do I think that will happen? Well, clearly, if the government has announced it, I want to believe that they've studied the feasibility and they've decided to open the country for tourism. Is it something that is risk zero? I mean, clearly, we're not health experts, but seeing from previous experiences with flights coming in the Gambia and people being on quarantine and some of them testing positive, we don't know clearly if it is safe. Clearly, that's up to the health professionals to say, and the authorities. Do you think this will happen? And do you think this will happen? Clearly, it's going to happen if they've announced it. So we can just keep on following and see how this is going to be conducted, and this is going to evolve. And we will probably have more information to bring on the platform as we go. But let's keep on following that situation with the tourist season. Yes. So I think going with local languages, Sehu Serili, I hope you're still with us, because I'm going to update in Mandinka. Okay. Starting with the figures. Let me go back to the figures so that I start with that. Yo, alimbara mbadi mandinkol. Mbe COVID Gambia lete. COVID Gambia momenti wala nyinti kibar di bunda kibar bundale me alon ko nka coronavirus jinna situation kachaje. Koku nata kibaro la karola ninga soto nka samba na njanne nka safele follow ninga bota saferola nga live discussion wala nyinti nga nyatli molla kibaro nata nka nyame nga sata moli wo nyama isaje mol sa fahamu membe kere COVID-19 la karola Gambia banko kanja. So nga nying platform nying nga start le comment to kabrin COVID-19 kuma sta banko kan akamta ko match ma fon wala nga kuma so watol la andung mba continue la le katu ngaje ko abe mol na fa kam bakele mol kan nyinin kale ni fa matangela screen auto jaay kan nyinin kale mone be kering malje barko mol ya kala mutanyame ni watin kono na wek mantara sonding courant ko ketambul problem balti nin kombina live to modo courant buka soto kabola fana ya ngaji ko internet do ko la fana be kering banko kay kajele ko internet fana mantara stable le wala tinna nyintil dantan ko non famatan na la kacala bari na hamo momenti wala nyinti ko wato wat nga nyasoto nga nyatli molla nga kibarol men soto nga sata ni mol yalon ko ni nyinin karol fana soto sila nyinin karol jabi manke docteur tiandu manke man sakunda do kulal fananti bari ni wolbe bulo be ni wol nyo konole ikajala ko ninto sulata kibaro men na wol bulu nka soto nole ni nga soto nga na sata molie wonyama sai na bota wala cases nyolla karola jata kende abunda la ministry wala announce ko ilani last testo ye menke banko kan aketa test keme saba tan woro wula nin konon toleti wol kono test keme anin killing keme killing anin killing wala nata kake positivity wala nyintiko ilani test keme sabo tan woro wula nin konon to ye mo keme nin killing ne taraje me alon ko woli corona nyin sotole COVID-19 la virus obe kono la courant nyin belale so abo wala nyama nyin testol men fanan keta akamta ko ika keleke ika test ika molle tombong yene test ni o testol ke ya samba lab ni resulto fintita ika wala kibaro sindi molma pour un salon corona la situation no banko kan nyame ya etandile ko ni watin kono mo sabale fanam banta ni COVID-19 ye mo sabale mio ta akamta ko coronavirus nyabe banko nyame ngabe dolbe je ake batandile ika batale badni treatment wota ika kendeyale dolbe je wolnio ka tujele dolbe je fanan wol ka fela suola kono ni fate la suo kono foka pare ni badin wol ye masakunda wala authorities nyol kumandike ka etandila ko ngamole soto member taja janni o bade o be kala janni red cross bita o fure o nyin kamala kata bade ika test le follow ni a test ni a je ko amari corona bala le nu isaje ko o mari fananda be kala ni report o kono le ba etandila abanta nyawo nya iba etandila ko amari fanan corona la fa ka tu testo fintita na banding kola testo fintina na ka etandiko corona la keta positive let yo nabota wala kibaro fintitana ko man to kaje ko serakunda lopitano ilafta yela mandila la kake corona virus treatment center ti wala ka covid-19 mon men yalon ko courant nyimbela ibe jara la dame ilafta serakunda lopitano kela wolto serakunda lopitano membe kanifi ilafta wol lopitano ni yela mandila la kake jara la to pour nyin covid-19 courant tol so kibaro ni mol barandi bakele katu mol yalon ne ko ni serakunda lopitano abe kummayarin na ni kombo area la nyame mol kabonan lajan ne kana jara dinola serakunda lopitano to bari sila ni na tafu mol ye ko serakunda lopitano to sai mol men yalon ko men man korona soto woltinano serakunda lopitano to katu be yela malele ka ke covid-19 treatment center ti wala nyinti covid-19 jaral lati wo jahalobe warla mol kanne andun akoni manna senea molma fana ma long abe o koni be kumasla wato menna so kula tin nata kiskisroke akuoto ngaje ko nying ila director loptano la director menketa Mr. Maneti wala na ta yetandi ko ha kumale me alon ko afotale bara manke ko abekela science kuleti ka to loptano fon man pare pour ka pour ka courantol fon landije loptano fon ku jamale be jimi alon ko abe manke ringele comme menketa ko oxygenoti wala ni fonyoti men yalon ko covid-19 soto ni ji ko ka ke bul problem moti sa wal kaso sula fonyo sifa menna pour que ma ko ila ni ji wala karola wo man soto serakunda loptano to anin ko mentata comme ila staffo wala ila dokulal fon man train ila dokula nyente karandila le comme covid-19 patient ol ike topoto nyame nganing i maral nya ni ila jaral nya nyanta tala silo menna wol be manke so ikaje la ko serakunda lopitano amang pare ka yela makake covid-19 jaral lati so ni na be nyama woto mol nyanta kala mutala wol nyama le yaje ko kule melon ko afota bara manke ko science kule avec la science neti na avec la fanan ku jamala be manyalon ko nyanta bulala nyokono la folo andu wala manke folo ngajele ko red cross fanan be ila be chemical nyin spray kandulal to letaring kaje ko nin coronavirus be dawo da isaje asifa ni watin kono ngajala ko itata airport le ni yundum airport to le jebe sisindika make sure ko hanatara corona be je o airport nyin kono asifa jebe sisenea so woketa kukum maleti andum ya ye mol kala mutandala le saji fana mol niyo silado mandi mol salon ko kolbe kerine ka kataka nyin covid-19 bayin na bankoka andu nyin sisindiro nyin la sisindo fana akumayata je bakele because akadula sene andile katu mo malon covid-19 virus so nya katara dame but ni kadula sisinditari wat ni wat o fana kabete ya jele ni ali ajibe kibaro to fanangaje ko Senegalais doctaro timo la nata num Gambia ni lokun tambila wal nata menna wala nyinti pour inin Gambia si bulo du nyobulu ya jibe nin mako iro sinano silo menna wala nyinti ko londo la karola wala ko nyoya marola karola katu molbe ala ne ko Senegal la banko itolla wartana Gambia janti andum ila doctorol la financiata na jan doctorol ti andu imeta itolla fana merin tan tol nyin covid-19 jararo kono tolti so ikaje le ko ye londi ndin sota kono le mealon ko asike asintol na fanol so inata le kanan na dulal jibe ka jibe na do kunya fana be nyame itata lab nyol tole men keta MRC nyol ti ani national lab membe senatorium membe kotu yol tobe ya ile ka jibe ni doctorol ni mol ka chatale inin health minister jata kende abunda la minister fanan kachatale ina tala bang president Barrow ya isita ufana ya ina kachata je so ikajele ko ntol bebe ECOWAS regional kono wala nyintiko ECOWAS banku be ECOWAS kono ECOWAS fon ya moli ya mariela yela grupo ni moli ya mar wala nyintiko nkal nyoso hakilo landum kan londo londo talantalan nyote maisaje ko nimme londi soto karo menna fanna menna asi modol muna fanan o karola so wala nyinti ko alinga nyoma koy nimme ye sembo soto karo menna asa monyo ma koy nole so wala tinanga mera nyin doctorol botana Senegal ina atana kana visit ken na Gambia banko kan ye til sabale ke banko kan ina ta muru so sinaji be kolbe kala nyame ngani ni tata fanan be nyoso no la hakilo la nyame nyin covid-19 la karola sike nyali fenjele si mol nyamar no menna aning be mbulo dun na nyobul nyame isaje ko nyin covid-19 nsa keleno ha so nabota wala nsafono ko kabo corona kabo covid-19 la dati watu follow la banko kanja Gambia ja kana fobi technical person, if I can have the figures on the screen, please, regarding the global figures regarding the COVID-19. So, occasional men confirm ta banko kankabo COVID-19 la dati watu follow la Gambia ja kana fobi la case wuli fula kemo woro anin tan sayni woro case wuli fula keme woro tan sayni woro kabo covid-19 la dati wati follow la banko kankana fobila wala sotota wala confirmta anin mo tan kononto wala la fa confirmta banko kan kabo covid-19 la dati wati follow la Gambia jan kana fobila anin meni alon ko kende ata wo kono fana aketa mo keme woro nin kilin neti meni alon ko covid-19 ya sotole bari na ta kende ale yo aketa mo keme woro nin kilin net kibaro fana ya etandi ko Serekunda nyin atodu ndemban clinic membe bakaw kodo sototale makoyro natale pour l'optanyo nyin sa renovate wala nyinti ko sa kuta yandi makoyro natale akamta ko kodo natale memba tinna ko do ko be continue no lale andum hamo mu ñeneti pour ndemban clinique ni asike covid-19 la jaral bunda bati banko kanjang Gambia banko kanjang ibe wala fero landika andum akodo natale sa akamta ko wodo ko nyimbe kumas lale sande ngaje ko basse fanan ka tu kibaro mandan kibaro manyanda danna combo area jandam mala nka traila ngaji be santoto fanan membe kirinjan so ngaje ko basse ye motan ne aresnu men yalon ko ye alaman dala si wuli lulu la ka tu kofiu wala nyinti ye masakunda ye wato men londi me alon ko amanyan na motar la silaka amanyan na motar la mbedol kan yo wato men londi men keta ka botalantan na ka fotala lulu men ma wo respect masakunda ye tandilal ko bo maril alaman la le so ka jala ko wo mol ye alaman le wuli dala si wuli lulu anduni ma jo fanan ibita ibela la kasoto le fo sanji killing so ni yaji be mune jarta wala ngamera akole hata nyawo nyang mo manyan ne fandula dundila wo trouble sifa kono kabo talantan na kata fo talan lulu mo nyanta ferol be kala la awetarela suwo kono katu ni ka fo menna authorities ni tara silol kan asike ibina mantora lale yene itora yene alaman wala yena isambal wanya tilingola janni o bebi tar laje kabo talantan na kata fo talan suba yetare la suwo kono yesabati la suwo kono wala koytaje anana bota wala fanan kam ka fo nyame na live wol kono masko mu kuleti malo ko farlolan silan ya farla yandi banko kanne mon nyanta natara ibe dulato me alon ko ini mol lebe nyokan e nyanta ye maskodu katu ni wo keke fanne tankande anda siki kam mol fanan tankandile akumayata bakele munga jele ko modol beji kabla pasase moto kono le ni bulata pasase moto kono ye masko ni wura ni ye masko ni dum ni futata police checkpoint auto ye masko etare la bar ni tambita checkpoint la doron ika masko ni bondile akamta ko ika atra la ka police wolle nene ka etandila ko nga masko dunne bar ni tambite la doron ye masko ni wura mol nyanta mellon na ye wala nyinti ko ha masko amandia katu kando be kerinne andu tumodo puriye niji akono ake batandile bari fenne me alon ko tankandiran wala ni adu ke fanne tankandi andu asike kam mol fanan tankandil so akumaya tale nga kata nga masko nyin na kumuta sobe yala nga akuonyin tamanda anyama fo janni nin covid-19 be bolan na bankoka masakunda ya KMC janni mba futula masakunda la karola nga itandiko KMC ni aji be nyin KMC regional nyin kono ja municipality nyin kono safo ko ibe ya iba kata kanne kaje ko marsewol kono ye mol kana sutiya nyola ikaw ko nyin tamandi nyame wala nyinti ko firlal ni sandirlal ika katale ko distance yetare tema ika katale ko ni momona ta kana wafirola ikana sutiya wafirla nyinna wala nyinti ka katale ka mol tankandi puri kana sutiya nyola ibo ferol landi kam marsol kono le KMC area nyin kanja anin bulkudlal fana ibol fana lafa kan sato kono la ni marsol kono ikajela ko mol si bulo kuno wato watandin bulko te keno te kala mo bul problem moti KMC le bo ko nyin kata kam banko kanja masakunda fana ya etandi kibarol kono ko tourist season wala nyinti ko molmen kana Gambia kumpa borola anin kana Gambia nyin gibe kana Gambia visit nsafo masakunda ya etandi ko o wato nyin kana asile wala October ti andu nyinan akake 100% October la akadati iko nyinan iba mutala o wato la fanana kabo October la tourist season nyimba kumas la le kajela ko momo laftana la Gambia kana Gambia visit ibina nole bari sartol men be je wala nyinti ko jen ni ba futa la banko kan inyanta coronavirus test nyin kelale wo test nyin nyanta kela amanyan na tambila til sabala janni be futala nan Gambia a resulto nyi manyan na tambila til sabala janni be futala Gambia ja kaje ko corona man tarela wo test nyi nyanta o kelale janni be na Gambia na bota wala fana ya etandiko quarantine wala nyinti ko ni futata nan ike dundi hotel o mento wo handkabi wo be continue le wo mutil lokul fula quarantine leti wo be lorin ne handkabi so momo naftana la Gambia visit la tourist season salon ko quarantine ni abe kerin ne handkabi 2 weeks ibe aussi la hotel oto lo li aussi hotel oto o kono ila testo la resulto be fintila ni la testo la resulto fintika natara a negative tale wala natara covid-19 mantarela isina fintieta sato kono yete badingol wala kafnyol gibe tourist season yete la tourist season in continue but ni la test kita positive ti woite ala wala so ning tourist season ya ta nyame banko kan ning covid-19 jamano kono wo man sakunda lam mala sa fono aninyi jata kende abunda do kulal bari baro nyin natan tol kan wala nyama kaje ko tourist season ni abe lorinne andan abe sotola ka bo October karol so sa fono wala nyama wala keba kibarol tin kuma ta consimen sindi molma so nga katale ku dia mo mandia barinka katale doron so mba fala moli ala baraka baki ala baraka mbe murla nan kana live doke nkambatun ne ninga kibarol soto men yalon ko abuita do mandi nga kafu nyoma ngana si ngana live ke tumodo ni mola ka ke bar sainte amari ni manna ama bendino ni silan ka tu ku dole lata mari kan bari namanke woti tumodo mo fulale katara kibar dante wala we have a question hi Bintou, if we have a COVID-19 negative test why do we have to quarantine? Good question, but that is up to the health authorities and the Ministry of Health and the government to answer, but clearly I mean this is what transpires in the announcement that we have received. And we would still inquire more because it's very important to understand the logic behind all that. But in the meantime, we can only convey the information that we have received, okay? Yes, so keep on following us. I'm sure that we'll be providing the answer because we're also very interested to find out, okay? Thank you. Okay, clearly, I think I've gone round. I've shared the bits the bit of information that we had compiled for tonight's live. We will certainly come back live, if not tomorrow, then the day after. And we always try to do it in various language, Mandinka, Wolof, Fula, or you name it. We try to do in many we try to conduct the live in as many languages as possible as we go. And we thank you for following. And we will keep on trying to relay verified and reliable information. Thank you so much and have a good night.
Tikluma xamal la ni jarna ko xibaar bi ma la andil COVID-19 mooy corona virus lépp la àdduna li ma jaaxal nag ci moom mooy xàmmeewul bu rek baatoo la tax docteur yi ci àdduna ñoom ñëpp jóg nañu ànd ak ñun ngir xeex leen ba jàngoro ji jóg fii ci suñu askan leen Gambia Red Cross Society ñi di ñoom yónni woon te ma xamal leen ne wéru askan wi moo leen tax a jóg